Thank you, Girly, for passing along the next and final part of our group presentation, and that is the conclusion. So this theory allows a nurse for greater therapeutic nurse-client relationship to help the client understand that illness is a part of the systemic cycle of wellness. This theory is a fluid concept of which each nurse can take their own interpretations and work with their clients to help them return to optimal level of functioning. To facilitate the clients to become aware and recognize their own patterns, the nurse needs to be in touch with his or her own patterns. Nurses are also required to learn and practice being fully present with the client and listening to the stories in order to perceive their patterns and view the story holistically. Brown, 2010. It is a valuable theory that views the health of all persons regardless of the presence or absence of disease, and includes disease as a meaningful manifestation which can assist clients in not only with acute illnesses but also with chronic illnesses or disabilities in recognizing that they all still can achieve health and finding a greater meaning in their lives. This theory can also help some clients who constantly show symptoms, although the previous health problems were removed, through facilitating them to recognize their life patterns and find new patterns so that they can maintain their health without depending on medical help. This theory can also be useful for current nursing that requires continuous care outside the hospital. The nurse can support clients by recognizing their patterns, emerging new patterns, and managing their health in creative ways. Newman et al. 1991 is cited in Brown 2010, page 467. Every person in every situation, regardless of how disordered and hopeless it may seem, is part of the universal process of expanding consciousness. This is a process of becoming more of oneself, finding greater meaning in life, and reaching new dimensions of connectedness with other people in the world. Newman 2010 is cited in Nursing Theories 2011. So let's think about it. Think about a client who you can apply Newman's theory into his or her care. How can you facilitate this client to recognize his or her pattern so that the client can manage their health and find meaning in his or her life? Any questions? So this concludes the end of our presentation. As you can see, we have references at the end. And Group 2 would like to thank you for listening to our presentation.